All right. Hi, I'm Samuel Brehm, and I'm going to be presenting with my teammate Hunter Adams for Team 40 on our proposed modification to N95 masks to alleviate the hospital shortages. So, as we all know, the COVID-19 pandemic has led to shortages of PPE, and the N95 is in particularly short supply. And this is because it's the gold standard for non-powered face masks due to two qualities. Number one, its filtration efficiency, and number two, its face fit. So currently, healthcare providers are either reusing unsterile N95s, which is obviously bad for health reasons, or they're attempting to disinfect 95s, which leads to filter degradation and other things, or they're using alternatives, which either don't offer good enough filtration or don't offer good enough face fit. So our solution takes advantage over the fact that when N95s wear out, it is the filtration medium and not the face fit that wears out. Our solution takes old N95s, and instead of throwing them away, we coat them with a non-breathable material, such as duct tape, to eliminate the degraded filtration. And then we cut two holes in the mask and slide in 3D printed adapters and silicone rings as seals. And so now that old N95 is essentially a makeshift respirator, and you can attach replaceable respirator filter cartridges. So its face fit still comes from the old N95 body, and now the new filtration comes from the replaceable cartridges. And just in case there's a shortage of respirator cartridges, we came up with a 3D printable cartridge. And these can be assembled by wrapping N95 or HIPAA filter cloth around a cone and then clamping it down to the cone using a 3D printed retention ring. And so now I'll turn it over to Hunter to talk about the implementation and the healthcare impact of our solution.
Hi. So first, let's talk about the feasibility in implementing in an actual hospital setting. So first off, there's no mass manufacturing actually required for our solution, and it's extremely easy to implement at a local level because we only require materials that are either easily available, such as duct tape or N95 fabric, or we can incorporate the use of existing 3M cartridges that can already be purchased, or in addition, all we require is a 3D printer to get the plastic. And in addition, we would provide a guide for healthcare professional instructions on how to modify their existing N95s. It would take probably less than half an hour to actually assemble, and we could realistically send out our information and instructions and get these in hospitals starting today if we were able to. And so additionally, because everything we're doing is being constructed from standard parts, we're extremely likely to get a noise rating for filtration efficiency because we're using the exact same filter material that an N95 would use, and we're using the exact same facial fit that's provided by an N95 mask. As you can see here on the bottom, here's a visual prototype of the differences in replaceability and assembly of our device. And yeah, it'd be extremely easy to implement. So finally, let's talk about the healthcare impact. So we are once again having the equivalent fit and filtration that would be provided by an N95 mask. Because we're using a traditional N95 mask that would already be present in a hospital setting, it's extremely easy to source these. And additionally, because we are putting a coating on the N95 mask and we're using plastic parts, it's extremely easy to disinfect in a hospital setting with something as easy as isopropyl alcohol, glutaraldehyde, ethylene oxide, etc. And so it's extremely easy to disinfect in a hospital setting with hospital disinfectants that are already present. And because of this, we tremendously increase the lifespan that a single healthcare professional can take advantage of a given N95 mask. And because we're using pre-existing filter cartridges, or they can be 3D printed, it's extremely easy to replace the filtration component in order to make sure the healthcare provider is at maximum safety when they are using the device. And additionally, other design teams in this design competition have been exploring ways of being able to disinfect already present N95 masks that are used in healthcare settings. If these teams are able to come up with ways that can disinfect an existing N95 mask, it's likely that there could be like a slight degradation to the filtration efficiency. So then that's where we could pick up in sort of a synergistic element where we can both tremendously increase the lifespan that we can get out of an individual N95, because all we need is just the fit provided by the mask. We provide our own filters. And so ultimately, we are tremendously extending the lifespan of an individual N95 mask within healthcare. and we would ultimately alleviate healthcare professional mask shortages, and we provide even a reuse for unclean or compromised N95s that are currently being used and having to be reused in healthcare settings. And so for all these reasons, we hope to alleviate healthcare shortages, and we stand open for questions. Thank you.
Great, thank you so much. Are there any questions?
Hi, I have a question.
Yes.
So do you have any concerns that the glues that are inherent in the duct tape could act as a respiratory irritant when they're inhaled through the mask?
So we can really use any seal. If there's a different tape that doesn't have that same glue, we could use it. Anything that's non-breathable, any non-breathable material, as long as you cover it up and cover the old filter up, it should be fine.
I was wondering if the mask part is plastic, how are you going to ensure that it still has that fit like the N95?
So we're still using the body of the old N95s, and so it's still going to have the same fit that the N95 originally has. The only modification is that now we're cutting 2 holes into it and then adding the adapters. So the fit is the exact same as when it was just the ordinary N95.
But you will be putting plastic over that and over that piece.
For your filters, would you imagine being able to reuse them or having them be disposed after every shift, let's say, in a healthcare setting?
So the way respirators work now is they're disposed after the shift, or whatever. Or if it's a spray paint respirator cartridge, after you're done spray painting, you dispose of it. But in theory, you could just get rid of the filter material and replace the filter material if you really wanted to. But they're easy to make. They're much easier to print and make than masks, and I think that's a real advantage.
Are you coating both the inside and the outside of the existing N95 with the tape-like substance?
So no, we can coat both, or we can coat only one, as long as the mask isn't permeable anymore.
I was just curious because I feel like if you didn't coat the inside of the mask as well, then the existing N95 would still become saturated when breathing. So.
Right, and we could solve that by only coating the inside as opposed to only coating the outside, but we could just coat both just to make sure.
Awesome, thank you.
I have a question about it. So with cutting the holes in it, would there be a proposed method of doing that, or would it be anyone with just scissors or something would kind of cut a hole into this? Like, let's say, you're on a nursing unit and you are working with a patient and you need to reuse this now. What tools would you use to actually make those holes?
A hole punch would be ideal, of course, but you could probably do it with scissors. And there's going to be a seal there, and there'll be more than enough overlap to deal with the, the imprecision that's involved with, cutting a hole with scissors. But it should be fine even with scissors.
Okay, thank you.
So I have a clarification question. So do you plan to have the physicians and nurses do this themselves and assemble it themselves, or are you going to assemble it outside and then deliver it to them already assembled?
Honestly, either one. We could. The whole goal is that we could reuse old N95 masks, and so the old N95 masks would be at the hospitals. So ideally, the modification would be done at the hospitals, but it could also be done ahead of time and sent to the hospitals. Both are a possibility.
All right, so two follow-ups, I guess. If it's done at the hospitals, how do you plan to make sure that it still meets the federal regulations required for N95 masks? That's the question.
Not sure, honestly. As we'll I guess we could probably set out guidelines, and if they follow the guidelines, then it should be. But I'm not sure how that would work, to be honest.
Okay. And then the other follow-up, if you take them out of the hospital, do you have a plan to address like the increased shortage when you take the N95s out of the hospital to modify them before sending them back?
Yeah, I think the increased lifespan would drop, at least like temporarily, when you took them out to modify them. But I think the increased lifetime eventually, like long term, would more than make up for it.
Yeah, additionally, we have like anecdotal reports that some hospitals are actually just keeping their old N95 masks for like future use, like when they can eventually come up with a method to disinfect them. And so they're like literally just sitting in a storage closet. And so like we could provide like a UV light or a dry heat oven disinfection to those. And even if like the filtration capacity is like slightly damaged on those old masks, because they're disinfected, like it's still probably better to incorporate our solution to those old masks that are just like already sitting there unused. Also, additionally, there have been like reports of like old N95 masks sitting in like warehouses that the FDA is not distributing because there's like it's past their expiration date. And so like if there's ever an N95 mask that's expired, we could like definitely use those too. So there's plenty of ways to avoid taking them out of current hospital circulation.
Awesome. Thank you so much. Time is up for this, but please share your feedback on the form. And thank you guys so much for presenting. The next team